Good afternoon, ladies and gentlemen. Thank you for joining us all today as we launch Public Health Week. As we begin this week's observances, I would like to take the opportunity to recognize the many successful public health programs that we have experienced over the years, such as the control of infectious diseases, safer and healthier foods, and the reduction in smoking prevalence. These are just a few of the outstanding public health programs administered through the Department of Health. Like many modern societies, Bermuda has to respond to the growing trend of non-communicable diseases such as heart disease, stroke, diabetes, and cancer. The Ministry of Health remains committed to addressing these diseases and achieving better health outcomes for our entire community. However, we can only achieve real success in reducing the prevalence of these conditions with the help of each and every member of our community. The theme of Public Health Week is Commit to Change, Small Changes, Big Results. Commit to Change focuses on the following areas: choose water, exercise daily, and eat more vegetables. These are small changes, but tangible changes that will help us to take positive steps as we attempt to prevent non-communicable diseases like diabetes, cancers, and cardiovascular diseases. Non-communicable diseases continue to be the leading cause of death and are strongly related to lifestyle factors such as poor diet, physical inactivity, and smoking. And it is important to know what you can do to prevent or reduce your risk of developing chronic diseases and protect your mental well-being. This year, we have included the focus on balancing mental well-being. There are many people who are affected by mental and neurological diseases, including depression, anxiety and bipolar disorders, schizophrenia, and dementia. Last year, the World Health Organization acknowledged that mental and neurological disorders can be a precursor or to a consequence of non-communicable diseases. They share many of the same determinants and consequences and frequently occur in the same person. Risk factors for non-communicable diseases such as sedentary behavior, unhealthy diets, and harmful use of alcohol are also risk factors for mental and neurological disorders. Among our working population, we must emphasize a proper life-work balance that reduces the stress and promotes healthy outcomes. Positive lifestyle choices begin in our young people by encouraging them to eat healthy foods, exercise regularly, and pursue activities that promote healthy lives. While we have made considerable changes and progress in public health, further work is required to achieve the better health outcomes for us all. This is a priority of the Ministry of Health, and it requires all stakeholders to have the courage to make these transformational reforms. Excuse me. When it comes to our health, we need to do things very differently if we want to get different results. The time for change is now. Just as I ask that you join us this week and throughout the year as we work together to build a healthier community. I'm very pleased to open today's events. Please take the time to visit each area. There are various screenings, activities, and informational booths here on hand for everyone, and I would invite you all to attend the other events that are scheduled for this week, such as the Launch and Learn, which is entitled Mental Health in the Workplace, and that will be tomorrow at the Bermuda Society of Arts, and then the Farmers Market, which will be on Wednesday, and it will feature local farmers and produce for sale, food demonstrations, and food vendors, and that will be at City Hall starting at 10 a.m. So thank you all to the ministry team in particular who have organized these events, and thank you to all of our key partners for participating in making today a success. Special thanks to all of you who have come out today, and I want to let you know that you are all part of our mission as we try to develop and establish healthy people in healthy communities. Thank you very much.